Hi, my name is Rakeen, and today we'll be talking about bladder health, or don't hold it in too long. Today we'll be looking at a few agendas. Firstly, the importance of bladder health awareness, bladder health statistics in Malaysia, bladder anatomy and physiology, common bladder diseases, and prevention and treatment strategies. Let's look at the importance of bladder health and awareness. So why does bladder health matter? Firstly, maintaining bladder health is essential for proper urinary function and overall well-being. It's also a good bladder health helps prevent urinary infection and long-term complications, and recognizing symptoms early allows timely medical care to avoid serious bladder issues. So how does the impact of bladder diseases affect the daily life? So bladder disease is caused discomfort and frequent urination, which impacts daily physical well-being significantly. On social and mental health impacts, incontinence and symptoms affect social interactions and mental health, leading to isolation and stress. So raising awareness and providing support are essential to improve quality of life for affected individuals. Let's look at some statistics in Malaysia regarding bladder health. Firstly, we look at nocturia, which is the frequent urination at night. So overall prevalence for nocturia is 57.3% of Malaysian adults. And frequency, this breaks down to 34.1% for one void, 15.3% for two, and 7.9% for three or more voids per night. Age and gender prevalence increases with age. So younger and older women are more likely to have one void per night than men in the same age groups, and middle-aged men, 41 to 60 years old, are more likely to have two voids per night than women in that age group. Let me look at another bladder disease, urinary incontinence, or UI for short. The prevalence in women varies widely from 9.9% to 44.1%, likely due to different study designs. When we look at the age prevalence in elderly, overall prevalence is 9% to 9.9% in Malaysia. The prevalence in elderly can be 30 to 50% depending on age, with rates of 9% to 9.9% reported in one study affecting women more than men. So the risk factors include chronic constipation for older women in rural areas. Okay, so this one is urinary tract infections, or UTIs for short. So mainly affect children. So children, a 2013 study on school children found a 3.8% prevalence of UTI, with higher rates among girls than boys. E. coli, or Escherichia coli, is the most common organism causing UTIs in both children and adults in Malaysia. Regarding antibiotic resistance, studies in Malaysia have also noted the presence of antibiotic resistance in bacteria causing the UTIs. So older adults and women in Malaysia have shown increased susceptibility to general bladder conditions. Lifestyle choices and existing comorbidities are crucial risk factors for bladder health, and recognizing risk factors help guide effective bladder condition prevention strategies. And in to the healthcare accessibilities and challenges, remote locations in Malaysia limit access to specialized bladder care services for many patients. And economic constraints affects patients' ability to afford timely bladder disease diagnosis and treatment. And overcoming barriers is essential for early diagnosis and effective treatment of bladder conditions. Let's look at the anatomy and the physiology of the bladder. For the structure of the bladder and urinary tract. Bladder function and structure. The bladder is a muscular sac designed to store urine safely until release is needed. And ureters connect which are the connective tubes, connect the kidneys to the bladder, transporting urine effectively and efficiently. The urethra allows urine to exit bladder and leave the body. So regarding urine collection, the bladder collects urine from the kidneys to store it until it can be expelled safely from the body. And the bladder expels urine to remove waste products, helping maintain the body's fluid balance and overall health. Look at the mechanism of urine storage and release. The bladder stores urine at a low pressure through coordinated muscle relaxation, preventing leakage and maintaining comfort. Neural signals regulate bladder muscles, coordinating storage and voluntary release of urine for continence. And voluntary muscle contractions enable urine release, ensuring controlled and comfortable emptying of the bladder. Let's look at some examples of common bladder diseases. Of course, we have the urinary tract infections or UTIs. So UTIs are bacterial infections that primarily affect bladder and the urinary tract. Symptoms include pain, urgency, and frequent urination, indicating bladder infection. And prompt treatment is essential to prevent complications and further infection spread. Then we have overactive bladder and incontinence. So overactive bladder causes sudden, intense urges to urinate that can lead to involuntary leakage. Incontinence due to overactive bladder adversely affects daily activities and emotional well-being. And management includes lifestyle modification and medical therapies to control symptoms effectively. Then we have the bladder cancer and other serious conditions. So bladder cancer is a serious condition that requires urgent and early medical diagnosis for effective treatment. Early diagnosis of bladder cancer significantly improves treatment outcomes and patient survival rates. Understanding the risk factors and symptoms of bladder cancer is critical to prompt medical consultation and intervention. So here are a few prevention and treatment strategies for general bladder conditions. Maintain hydration. Okay, so drinking adequate water helps to flush toxins and reduce bladder disease risks. Good hygiene habits also helps to prevent infections that can impact your bladder health. Steering clear of irritants supports bladder health and lowers disease risks. For medical interventions, antibiotics are generally used to effectively treat various infections, especially bacterial infections, prevent disease progression. Specific medication helps manage bladder control issues and improve patients' quality of life. Surgical procedures are performed when necessary to resolve the medical conditions effectively, and personalized treatment plans enhance the effectiveness and outcomes of medical therapies. Of course, patient education is important as well. Educating patients about the symptoms and management helps empower control over bladder health. Support groups provide emotional and practical assistance for ongoing bladder health management, and access to healthcare resources ensures continuous support and guidance for patients. In conclusion, maintaining bladder health is essential for overall well being and quality of life. Spreading knowledge about bladder health helps people understand the risks and prevention methods, and promoting early prevention and treatment improves bladder health outcomes in Malaysia.